This is Dr. Charles Kemp in Jonesboro, Arkansas. I founded and started the children's clinic here in 1959. So we have passed more than 50 years of continuous operation. We now have a very large pediatric group with 3 nurse practitioners and a pediatric neurologist. So we have an ongoing clinic of pediatric practice here in this area for a very, very long time. We see patients over a large area. We started using medical electronic records 5 years ago and have been very, very, very pleased. Nothing but great improvement when we started using electronic records. I only have to remember the old way of doing it to realize how much better this is. The old records were disorganized, very difficult to read, trying to read different doctors' handwriting, very, very difficult. We even had medical records get lost and couldn't find them at times. Then we had dictation, and the dictation was usually 2 or 3 days before it got into the chart. And in a practice like ours, we work Saturdays and Sundays. So frequently you would be asked to see a patient on Saturday that one of your partners had seen on Friday, and there would be nothing in the chart. All of that has been eliminated with medical electronic records. Not only are they more thorough, more complete, easy to read, less errors, our prescriptions are sent electronically and very much easier for the pharmacist to read and interpret than the old handwriting medical records were. So all of this has been an enormous, enormous improvement for me. In our practice, we see a lot of psychological problems, emotional problems, social problems, and our computer will alert us. So if I'm getting ready to see a patient that I'm not familiar with, information will come up that alerts me that this child has specific problems that I need to be aware of, from allergies to emotional problems to school absences. Occasionally, a marker will tell me that I'm getting ready to see a child that's missed excessive school, so I need to be aware of that. So it's nothing but positive improvements with the medical electronic records as far as I'm concerned. Specifically with patients and specifically with diseases and accuracy, overwhelmingly easier. As far as anything negative I can say, the only negative thing I could say was the cost. It did cost us quite a bit of money initially to get started. And for approximately a month, I couldn't see as many patients as I previously had seen. But after about a month, I found myself seeing as many patients as I ever did, if not more, with the computer. But there was an initial period of getting acclimated to the computer. Not a difficult decision. We very much wanted to do it. We did have to weigh the cost, being in practice. We felt like we had enough providers that we could bite the bullet, but the cost was scary to us. And could we get our money back? And would it be worthwhile to invest this kind of money to do it 5 years ago? But we wanted very badly to do it. One of my partners, Dr. David Matthews, is a very skilled person with computers, so we had a plus there that he could help us in areas that we needed specific help and training and ideas. And we did a lot of looking around. We wanted to program solid in pediatrics, and we didn't just take the first system we saw.
Did you actually visit a practice?
Yes. Yes. We visited on sites, and I highly recommend that. You really need a program specific for your practice, and you can do that. And I think you do need to visit someone in a similar situation to yours. Oh, gee, it would be hard to say, but we will see sometimes 200 to 300 a day when all of us are here. As I say, we have 3 nurse practitioners, and we work every day. We have night clinic, early morning clinics. We have Saturday clinics. We have Sunday afternoon clinics. So we're actually open 7 days a week. Some of us do. I leave mine on my desk. I'm clumsy, and I would drop it by the end of the first day. So we have little wall desk that you can put it in the hall, see the patient. It's an individual thing. Some doctors take it into the room with them. I don't particularly like that. When I go to the doctor, I want him to look at me and eyeball me and not be working on a computer, but that's a personal thing. So I don't work on the computer when I'm taking a history or talking to the patient. I come out in the hall and do it, but that's a personal thing. Some doctors do that in the examining room, but I don't like a doctor to do me that way, so I'm not going to do a patient that. But the patients accepted. I've not ever had any problem that I saw from patients. They were glad we were doing it, and if we had questions, we said this will be more accurate, more thorough, and so forth. But they've all been very pleased, particularly with sending prescriptions to their drugstore. Sometimes it speeds things up. By the time they get to the drugstore, the prescription's filled, and all they have to do is just pick it up. No, I don't think there was any problem with patients at all. All of us did have to spend a little time asking questions and finding little areas that, and I still learn something new almost every week, about the computer. But I think it went very smoothly once we got into it. I think the accuracy, I think we were far less inclined to make an error with the computer, with doses of drugs, with prescriptions. It was so much more accurate and easier that I felt from day one that the accuracy was far better than calculating doses by a computer or something. So it was very accurate, and you have choices of drugs to use with the doses on there. You're much less likely to make a mistake, in my opinion, doing it from raw memory than you are with the computer. And it answers questions for you and so forth. It'll be hard. I can't say this specifically a given patient, but as a group of patients, yes. I think that I'm reminded more. The computer reminds me of things to do, to be more thorough, to include social histories, dietary histories, things that I might not by memory recall to do. It's a very systematic way of doing things, and I think I'm much more thorough in my history as I go through the litany that's on the computer. I cover everything from the entire family history to social history to physical and so forth. So I think I'm much more thorough with the computer, and it keeps me better organized than trying to do it in some other manner. I think we've all been helped here because each of us see a variety of patients, and we see each other's patients, and it really helps if I'm seeing a patient of one of my partners, he's not here. The computer is so accurate that I know exactly what he was thinking about or what he was doing or what he was planning or what his game plan was, and I can read it and see it. So I think there's far better accuracy when you're seeing somebody else's patient in a clinic. Nothing was more frustrating in the old days to see a colleague's patient and not really understand, well, what was he or she thinking? They didn't put down their game plan. Now it's there, so it's easier to do. I don't think any in our group have had great concerns. Concerns we've had when we hear groups that decide to put in the system of electronic medical records, but they all don't do it. I mean, that's a mistake. If you're going to put the electronic record into your group, everybody has to do it. I don't think you can have partial participation. So I would strongly discourage that. If you're going to do it, it should be a decision for the entire clinic, for every doctor. But we have clinics in Jonesboro that have electronic records, but not all the doctors use them in the same clinic. And there's nothing but chaos in doing that. So in our group, we all realized we were all going to do it or we weren't going to do it. And I think it's been accepted by all of us. I think it will improve medical care enormously. I think we've got a long way to go before we're there. Meaningful care, we hope in our operation within the year to have that, where, for example, whereby every patient we see will receive promptly a printout from our office of everything that was done from our office, that they will have a record. I think we've got a long way to go before we can intersect with other groups around the country. There's so many different types of computer systems. I think we've got a long way to go there before we'll be able to intercede with each other and do the kind of national electronic sharing that we should. Hopefully we'll get there someday. We've got a long way to go before we reach that point. I think some physicians are still scared. They're afraid they can't see as many people, or this is too complicated for me. I don't want to fool with it. And I think that's a mistake. I would say, certainly I'm an older physician, and if I can do this, anybody can do it. I don't think it's that difficult. It's a great improvement, and from the individual clinic standpoint, they need to do it uniformly 100%. I think we've got a long ways to go yet before we reach the national meaningful care that we're looking for. But this can't do anything but improve health care. We've not had that. I can't honestly say that that's been an issue any more than it was years ago. We do have a lot of, in our practice, we deal with young couples, and so we have a lot of broken homes, divorced homes, where there are a lot of legal problems and personal wars going on that we have to be aware of. And the computer, we have that where it alerts us if there is a specific situation we need to be aware of on a case. And that's a great help too, that there's a legal questions here about guardianship or that sort of thing, or who can see the records and who can't. That quickly comes up, and that's a great asset to having the computer. But far as patients expressing concern, no. Well, I would say what any physician realizes is that everything changes, and you either change or you fall behind, and you have to realize that medicine is a changing, developing science, and this is just another component of that. And it's essential that we change through the years and embrace changes, and even if they seem painful, we move forward, and that's the only way you move forward. And I think the computer is probably as profound a discovery as we've had since the light bulb. And if you don't know how to use a computer and get into this, you're going to be so far behind, it'll be like being unable to drive an automobile or something. I think we're going to fall behind. So to keep up and advance and change in the modern era, you have got to use the computer in your practice, as far as I'm concerned. As far as, yes, I think it is as profound as the improvements we made when we got the MRIs and CAT scans and fantastic diagnostic abilities. I think it ranks right along with that as far as a big new innovation. It would be like trying to get by without CAT scans or MRIs or other diagnostic testing that we do with patients. This is right there, and it'll improve. 10 years from now, this will look antique. I mean, we'll be ahead of where we are now, where we can actually talk and communicate and so forth.